Tailbone pain can be very uncomfortable. It can feel really frustrating when you are sitting in the car or you're getting up and down from the toilet, you're having to sit down to sit in your chair to work. Tailbone pain can be very uncomfortable, and oftentimes it's caused by falling on your bottom or after childbirth or having some kind of trauma to that area, and now you're literally getting a pain in the butt. So today we're going to talk about tailbone pain and some simple relief strategies that you can work into your routine to be able to help solve this. My name is Dr. Dawn Andalone. I'm a pelvic floor specialist, women's health physical therapist. And your tailbone is this triangle-shaped bone at the bottom part of your spine. So it really connects to a lot of important ligaments, tendons, and muscles through your hips and your pelvic floor here at the bottom. And if you've had a fall, this can be a very common way to injure your tailbone, or through childbirth, or something else that really traumatically put a lot of pressure, unwanted pressure in this area. So if you're still dealing with tailbone pain and you have not found a resolution to it, make sure that you have checked out, that you don't have a fracture there or something that will require just a little more protection and a little more guidance with a medical practitioner. But from there, with your tailbone pain, there are some strategies that we're going to talk through and how to help you and things that you can start doing on your own. So therefore, it's not a pain in the butt anymore, and you can actually sit longer and be more comfortable too. If you don't already, a special tailbone cutout cushion, something that is going to be like a donut shape, is going to be very helpful in taking that in the car or at your desk. Whenever you're having to spend time sitting, you want to do that so it takes pressure off of it. So I will also link in the description below one of my favorite cushions to recommend as well. That is on Amazon. Now, next is doing some temperature therapy. And what do I mean by that? Well, you can mix between hot and cold, whatever is going to relieve your symptoms. There's no right or wrong, but people do find some relief in doing some heat therapy and having some heat around that area when you're lying down and supported with maybe pillows under your knees and you're in a comfortable position where you're having some heat applied to that area, or you're on your side with pillows between your knees and you lay a heating pad around that area so it drapes into that area. That can also be very comforting and feel better too. Some people do like ice because it kind of numbs up the area, helps initially with the pain. So it's based on comfort too, but switching between hot and cold when it is a more acute situation can be very helpful in the very beginning. So next is finding a position of comfort. So using a cushion, but also paying close attention to your posture. We often get a little bit lazy, or if you sit in a really soft, cushiony couch or chair, that we tend to sit back on our tailbone and put more pressure on it. So the more that you could be over these sits bones when you are sitting and getting over your, away from your tailbone and pressure on the tailbone, that is obviously going to be better. You're going to be able to allow those muscles to relax even more as well. They won't be tense, putting more pressure against the painful area too. So limiting your time sitting, making sure you're switching between standing, walking, and moving more is going to feel more comfortable. But you don't want to sit back on your tailbone, just really pay attention to staying upright over those sits bones in a more pressure relieving position. Movement breaks, I just mentioned changing positions, but making sure that you're getting enough walking, 20 to 30 minutes, periodically a few times a day. You want to get movement. Movement helps blood flow and circulation and will help that area heal. Just make sure that it's not increasing your pain. If anything is increasing your pain, dial it back and just start slow and steady progress. Don't feel like you have to do exactly what I'm saying in this video, but you do listen to your body. And so the most important part is trying to take pressure off of that area, but don't stop moving. Don't just rest, and don't just lie on your side and sleep, or don't just lay on your back. Positions of comfort are important. on, but you want to make sure that you are still getting movement too. There are some helpful targeted stretches that, as long as you're within about 10 days after you really injure it, that you go into some gentle stretches, because that time you give yourself to heal, you do want to gently start moving the muscles and the tendons and everything around in that area in a comfortable position. So I'm going to take you through 3 stretches that you can do and movements. The first one would be knee to chest, and just gently pulling your knee toward your chest for about 5 to 10 seconds, and then release that, and then the other side as well. That can stretch some of those deeper muscles and allows for a little bit of movement through that area, but in a safe manner, because your back is supported and your hips are supported too. Then next is a hip stretch that you can cross your ankle over your knee, and if you already start to feel a little pull there, then you can hold that, maybe even pushing that knee away gently. You can also later on get into a deeper stretch by grabbing around. I have my hands around my right thigh, and then I'm stretching the left hip area, all those deep muscles that attach to your tailbone, holding there for about 20 to 30 seconds on each side. Then the other helpful stretch that you can do is like a yoga pose, child's pose. So you're going to take your knees a little bit wider, and you're just gently leaning back and stretching from there. You want to allow that lower area by your tailbone to feel a little release, especially all those muscles through your pelvic floor. Do about 5 to 10 slow, deep breaths, and then shift your weight forward and then go back 3 to 4 times. That child's pose position can also be very helpful too for healing around the tailbone area. Then you definitely want to focus on core strengthening. I'm talking about some simple mat-based Pilates exercises. I have more videos on this channel all about Pilates mat exercises, but as long as they're not painful when you do them, I'm talking about exercises gently on your back, working through your abdominals, your lower back, and maybe even starting some little bridge exercises that are going to help your hip muscles. So doing some gentle core exercises. I'm going to show you one of my favorites here. So I have both knees up, and if that's too much stress on your tailbone, you can just start with one knee. But from here, I do a reverse march. So I'm slowly lowering one leg at a time, using my core and abdominal muscles, exhaling and drawing those in every time I lower one leg. And in doing so, you are supporting this midsection of your body and taking a lot of pressure off of there, protecting your back, and working your core is going to help carry over into your daily life when you have to lift, twist, bend, or move anything too. So if you feel like you're really in sharp, acute pain, definitely rest, get the donut, get something that is going to be more comforting and supportive for that area, or even consulting with your doctor about what over-the-counter medications you can take to just calm it down before you start doing more movement. So listen to your body. I hope those tips were helpful. When you're having tailbone pain, that can really hurt. And there are women across the board who heal rather quickly, and then other women will take months and months to heal from a tailbone injury. So you want to make sure that you listen to your body and do what feels right for you, but those strategies can be helpful. So thanks so much for watching this video. I hope you go back to watch some of my other Pilates-based videos, and I'll see you again soon on another video.